Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Anticholinergic drugs. The classification of anticholinergic drugs, we have natural alkaloids. These natural alkaloids are atropine, hyoscine are the natural alkaloids. Then we have semi-synthetic derivatives like homatropine, atropine, methonitrate, hyoscine, butyl bromide, ipratropium bromide or tiotropium bromide. All these are used. All these are semi synthetic anticholinergics. Next we have synthetic anticholinergics. In synthetic anticholinergics, we have mydriatics like cyclopentolate, tropicamide and homotriptine are mydriatics. We have antisecretory and antispasmodic agents. Antisecretory and antispasmodic agents are quaternary amines like propanthenine, oxyphenonium, clidinium and pipenzolate, and isopropamide and glycopyrrolate can be used. Then we also have tertiary amines like dicyclomine, velathamate, then pyrenzepine are used. Then we have a synthetic, one more type is vesicoselective or bladder type. These vesicoselective are oxybutynin, flavoxate. Then we have fesoterodine. Then we have tolteridine, and we have drotaverine and dorafenacin is present. And one more synthetic type is anti-Parkinson's, like we have benzaxel, piperidine and benztropine.
thank you and thank you for watching.